The Atlas of Heart Disease and Stroke is a data-rich tool anyone can use at no cost to examine the cardiovascular disease burden in communities across the United States. For those who receive funding from CDC's Division for Heart Disease and Stroke Prevention, the maps in the Atlas can be used to support your work. In this presentation, we will walk through examples of how you can use the Atlas to locate hospitals with cardiac rehabilitation services, assess performance on cardiac rehabilitation participation, and identify gaps and opportunities for interventions in your communities. For an overview of the Atlas or step-by-step instructions, go to www.cdc.gov and search Atlas of Heart Disease and Stroke. The Atlas provides easy access to a wide range of high-quality, local-level data. For this example, we'll be using data on cardiac rehabilitation availability, heart attack hospitalizations, cardiac rehabilitation eligibility, participation, and completion, number of cardiac rehabilitation sessions attended, and surrounding resources for improving cardiac rehabilitation availability. We can start by mapping hospitals with cardiac rehabilitation services. This is available as an overlay in the Atlas, which means it can be displayed over any map at any level. Here, we're viewing hospitals that offer cardiac rehabilitation services throughout the contiguous U.S. Before we begin comparing maps, it's important to note that maps from the Atlas of Heart Disease and Stroke provide important contextual information but do not indicate causation. Rather than drawing conclusions about relationships, we can use the maps to understand the characteristics of communities with varying needs and geographic proximity to hospitals offering cardiac rehabilitation services. This context informs program decisions that are tailored to the needs of each community. Now let's start to understand the context surrounding cardiac rehabilitation using additional maps. Here we see county-level heart attack hospitalization rates per 1,000 Medicare beneficiaries combined with hospitals offering cardiac rehabilitation services. Counties with the highest heart attack hospitalization rates are identified with dark red, and counties with the lowest hospitalization rates are identified with light pink. We can see that there are several counties with high heart attack hospitalization rates that do not have any hospitals that offer cardiac rehabilitation services. In addition to creating maps in the Atlas, you can also view information in table form or download the data. Once you establish a baseline for heart attack hospitalizations and hospitals offering cardiac rehabilitation services in your communities, you may want to consider additional factors. The Atlas includes data on cardiac rehabilitation eligibility among Medicare fee-for-service beneficiaries, which we see here. Counties with the highest eligibility rate are in dark blue, and those with the lowest eligibility rate are in light blue. We can see that some counties with the highest eligibility rates have limited geographic proximity to cardiac rehabilitation at a hospital. In addition to eligibility, you can also map participation rate among those eligible, completion rate among initiators, and the mean number of sessions attended among Medicare fee-for-service beneficiaries who initiated cardiac rehabilitation. The Atlas also includes maps showing access to broadband internet. This is important because cardiac rehabilitation delivered remotely via the internet may extend the availability of cardiac rehabilitation for some communities with high eligibility but little geographic proximity to hospitals offering those services. However, not every community has the same access to broadband. Here we see a county map of the percent of households without a broadband internet subscription. Some of these counties with high percentages of no broadband internet subscriptions, indicated in dark teal, also lack a hospital offering cardiac rehabilitation services. The Atlas offers an overlay of major highways too. These data, on top of broadband data, can help to better understand areas that have less access to internet-based cardiac rehabilitation services because of limited broadband, and lack access to in-person cardiac rehabilitation services because they are far from hospitals offering these services, or the major highways needed to reach them. Now we can take this map of households without a broadband subscription, hospitals offering cardiac rehabilitation services, and major highways, and bring in a map of cardiac rehabilitation eligibility. These maps can allow us to build a more complete image of what communities have the greatest number of people in need of interventions to help them access cardiac rehabilitation or identify regions where people eligible for cardiac rehabilitation may have the greatest challenges to participating in cardiac rehabilitation. The Atlas has numerous features you can use to make and share data and maps. Once you have created the maps you want, you can create a link to share each map, download your maps as PDFs, download the data used to make the maps, create downloadable county profiles, and view the data in table form. To recap, using the atlas, we made maps showing the locations of hospitals offering cardiac rehabilitation services, heart attack hospitalizations, cardiac rehabilitation eligibility, broadband, and highways. With these maps, you can document geographic differences, enhance partnerships, and tailor program planning to the needs of communities. For insights on strategies to increase participation in cardiac rehabilitation, please refer to the Million Hearts and American Association of Cardiovascular and Pulmonary Rehabilitation Cardiac Rehabilitation Change Package. This resource includes strategies to address transportation barriers, offer hybrid delivery models, and leverage the atlas to inform QI work. You can find this change package by using this QR code or typing out the link shown below. Thank you for watching. You can find the Atlas of Heart Disease and Stroke and instructions on how to use the atlas by visiting www.cdc.gov and searching Atlas of Heart Disease and Stroke.